Study out there, totally different topic. We're going to your health care now. The study says that those genetic tests that claim to predict cancers and other diseases, they're not reliable. Not reliable. It's the first big report on the issue since the use of these tests became popular. The tests, in fact, are so flawed, the new report says, that some people could be told not to worry when a real health risk is present. And others are be told to take drastic action when they should be given the all clear. With us now, Dr. Kevin Campbell, Assistant Professor of Medicine at UNC. Great to see you, Dr. Kevin. So just how big is this problem? How many of these reports have errors?
You know, there are tons of genetic testing companies out there, and before the last year, they didn't share their data. There are so many errors that are occurring. Nearly 20% of the different laboratories differ on what they think the particular result means, and that impacts us as patients.
So I read there's something like 17% of cases results are interpreted differently, to your point. So it's not just that the test may not be all they're cracked up to be, but then whoever's reading it may interpret it differently. Tell me about that.
So it's really important to establish a genetic test that actually you associate a particular disease with a gene, then you show that a mutation or a change in that gene causes the disease, and then you have to have some clinical action you can take. So we need tests that actually can predict disease, and then we can do something to prevent it. As physicians, that is a wonderful tool for us that we'll be able to use to help patients, but we have to have reliable testing.
Well, let me ask you this, because I get the impression that the tests themselves are big gaps in knowledge in terms of what they're actually looking at and the length of the DNA code. There's more information that's actually being analyzed. Help us understand the degree to which these are really last words on your health.
You know, I think the future of medicine is personalized medicine, where we use your genetics and your DNA to predict disease and to specifically treat you. The power of genetic testing is in pooling of data. And before the last year or so, we weren't sharing data between companies. Now we have this cooperative effort where data is being shared, and I think we're going to get real information that gives us reliable testing as we go forward over the next 5 to 10 years.
That is very exciting, and there's a brand new database out there that's going to do just that. I want to read to you, though, because I think the issue, the example of this that got everybody talking was Angelina Jolie finding out that she had the cancer gene. Here's what she said. I carry a faulty gene, BRCA1, which sharply increases my risk of developing breast cancer and ovarian cancer. My doctors estimated that I had an 87% risk of breast cancer and a 50% risk of ovarian cancer. I made a decision to have a preventative double mastectomy. How many Angelina Jolies are there out there who could prevent a horrible disease by acting early?
I think that the sky's the limit in terms of predicting disease this way and acting early. What we want to make sure we do is not give people negative results and say you don't need to do anything, and then they end up getting the diagnosis, or say you have a really high chance of getting cancer and then you do a radical surgery like this and it turns out it wasn't. So we need these tests to be reliable and accurate so that we can give our patients the very best chance of survival there is.
All right, the million-dollar question here, Dr. Campbell. What do I do as a patient? What does anybody out there who's watching you tonight do if they want to get, ahead of the curve on any family diseases? Should they take the test? Should they not? What should they do?
First of all, I think you have to work with your physician. You need to talk with your doctor about your concerns, your family history, and then decide together if genetic testing's right for you. If it is, make sure you also talk to a geneticist so that when you get this information back, you have people help you interpret it and also tell you how reliable this particular test is so that you can make really good, well-informed decisions.
Great advice, Dr. Kevin. Thanks for coming on this show. So good to see you. Thank you.
Thanks for having me, Gerri. Have a great evening.
You as well.